This is a female patient in her early 30s. About a year ago, she had lower eyelid fat repositioning at another clinic through the conjunctiva. Her primary complaint was that while the bulging fat was reduced, the tear trough became much deeper. The dark circles under her eyes appeared even darker than before. So, I performed a revision surgery for her. The procedure was done through the conjunctiva, focusing on fat repositioning once again. When I examined her, the tear trough ligament was still tight. I had to completely release that ligament. However, there wasn't much fat left to work with. It appeared that quite a bit of fat had already been removed elsewhere. In many revision cases, I find that the fat has been over-removed. I had to carefully release the adhered and contracted tissue. First, I addressed the tear trough itself. Then, I took the remaining fat, passed it through the tear trough area, and repositioned it evenly. This helped fill in the hollow tear trough to some extent. However, since there was underlying asymmetry, and fat repositioning alone cannot fix skin discoloration or visible veins, I had to find another solution. To solve this, I applied a very thin layer of Conslet Fat Graft directly beneath the skin of the dark circle area. By spreading it evenly, what happens? The brightness improves significantly. The veins and dark circles are less visible. The boundaries disappear, and that sunken look is gone. For patients like this, fat repositioning must be combined with Conslet Fat Grafting and fat supplementation. Particularly on the left side, where fat had been heavily removed, supplementation was absolutely necessary. Some fat remained on the other side, so to fix the asymmetry, I performed a subtle fat graft there as well. The deep fat repositioning goes inside the fat layer, while the Conslet Fat Graft is applied directly to the skin and muscle layer. If you look at the profile view, you can clearly see the tear trough and the remaining fat. One side looked even more hollow because of the remaining bulge. Even though she had some volume in the igiosal area, the tear trough remained deeply recessed. This was the core problem. It wasn't true fat repositioning, it was just fat removal. I made sure to release the tear trough ligament and move the fat down to fill that hollow space. You can see the tear trough clearly here, right? I repositioned the remaining fat across 3 distinct areas. By moving the fat down from the top, the bulge is flattened while the hollow area is filled. Since one side was deeper, I supplemented it with extra fat and used Conslet Fat Grafting to hide the visible veins. Doesn't it look much clearer and better? These photos were taken about 2 to 3 months after the surgery. The boundaries are no longer visible, and the dark circles on the skin have been significantly improved.